Dr. Richard Miller. I'm the Program Director for the Orthopedic Surgery Residency Program at Bon Secours Mercy Health at St. Vincent Medical Center. So the aim of the residency program is to train a general orthopedic surgeon who can thrive in a tertiary academic center or in a community setting. We want orthopedic surgeons to leave the facility with a good academic and surgical skill set so they can work in any environment.
OR case day, we typically start cases anywhere from about 7:10 to 7:30 in the morning. And they can be either light days or they could be heavier days. Just depends on who you're working with, what service you're on. If you're on a trauma service, obviously it's very dependent on what traumas come in. If you are on more of a house service or a general ortho service, Tuesdays will be very busy. Our program director, Dr. Miller, does all of his big joints on Tuesdays, so expect to be in the OR for long periods of time that day.
So a day in the life of an orthopedic resident, we get up early, start didactics at 6 in the morning. That's our education time. We have an hour of education every day. And then after that, typically grab a quick snack and get over to the OR. Typically spend most of the day in the OR. That's a few days a week. And then there's other days when we go to clinic, and that's where we book our cases. We take care of our patients there. We see our patients in follow-up. And then often in the afternoons, we'll have like a journal club or an outside event from the hospital. We go to a restaurant and we get together, meet up, and talk about recent literature in orthopedics. But overall, the week is very busy, but again, very rewarding. We get a lot of work done.
So the things that I think set our program apart from other orthopedic surgery programs is the early surgical exposure of the residents. They graduate to different levels of autonomy fairly quickly. And in fact, as a PGY2, we expect our residents to be able to work autonomously in a large level 1 trauma center in the emergency department without direct supervision. Those residents also go on to develop their surgical skill set early in the program so that later in the program they're refining their surgical skill set. And in our program, as a PGY5, we expect the residents to be really good mentors and teachers at that point.
I think that the most surprising thing to me, but on the same line, not at all a surprise, was how easy it was to get acclimated and feel like I was a part of the team. The other residents were super welcoming. They answered all my questions and just really made me feel like I was a member from day one. It wasn't oh, you're an intern, you're not a part of the team because you're a first year. It was, hey, you're part of this team, you're responsible just like we are, and we're gonna work together and everyone's gonna get better because of it.
I think the biggest thing about our program that offers us amenities is it's got a whole section of the hospital that's devoted to orthopedics. So our clinic is state of the art, it's very nice. We have all this new equipment, and then our library is right there next to the clinic. As well as our call rooms. The whole section of the hospital really makes it easy for us to not only do our work, but remain close to each other in that time where we can kind of grow in camaraderie as well as learn in our programs.
I think that the best part about this program is that we are a very tight-knit group of people that support each other, who have each other's backs, and not only that, we're learning immensely. You work hard, you're going to spend long hours here, but in the end you come out a very good surgeon and you're well prepared for whatever you decide to do in the future.
I think the biggest thing to expect in residency is growth. And that comes from a few different things: your personal growth, emotional growth, spiritual growth. The program is challenging, but it's so rewarding. And I look back at myself 4 years ago, and I'm a totally different person than I am now from the challenges you face and overcome. And I think that our program offers incredible opportunities to grow and to become the surgeon you want to be, the surgeon you need to be, and then also just grow as a person.